As we are talking about different diseases, this is the one more disease, that is Nipah viral disease. You might have heard about it. Recently, it was reported in from the our neighbor state called Kerala. So this Nipah viral disease is caused by Nipah virus. So Nipah virus was first discovered in 1999 following an outbreak of disease in pigs and people in Malaysia and Singapore. This outbreak resulted in nearly 300 human cases and more than 100 deaths, and caused a substantial economic impact as more than 1 million pigs were killed to help control the outbreak. While there are no other known outbreaks of NIV in Malaysia and Singapore since 1919, outbreaks have been recorded almost annually in some part of Asia since then, primarily in Bangladesh and India. That's a concerning thing. Virus has shown to spread from person to person in those outbreaks, raising concern about potential for NIV to cause a global pandemic. That's the thing. Initially, it is epidemic, then our outbreak. This outbreak may spread if you couldn't control at the basic level. It may spread and will become pandemic. Nipah virus is a member of the family, the Paramyxoviridae, genus Nipah virus. It is a zoonotic virus, meaning that it initially spreads between animals and then from animals to human. The animal's host reservoir of NIV is the fruit bat, also known as flying bat or flying fox today. And it's available even in Bangalore. We can see that those flying foxes. Given that NIV is genetically related to Hendra virus, another Nipah virus known to be carried by bats, bat species were quickly singled out for investigation, and flying foxes were subsequently identified as the reservoir. Infected fruit bats can spread the disease to people or animals such as pigs. People can become infected if they have close contact with infected animal or its body fluids such as saliva or urine. This initial spreads from animals to person is known as a spillover event. Once it spreads to people, person to person spread of NIV can also occur. The symptom of NIV infections range from mild to severe, with death occurring 42. That means the mortality rate is very high for this disease, and it can go up to 40 to 70% those infected. And if you look at the outbreaks in 1998, 2018, even in 2023, death rate was high when we compare with the infections. Now we'll discuss about this one in detail. Nipah virus infection caused by Nipah virus, as I told, is a zoonotic disease that can lead to a severe illness in both in animals and humans. So illness is severe. The virus was first identified in 1999 during an outbreak in Malaysia and Singapore, affecting individuals who had a close contact with pigs. Because the pig farms, what happens is still some theories are speaking about whether it is from a pig or how the pig got infected. That's again a question. And since then, the sporadic outbreak have been observed in like Southeast Asia, primarily in Bangladesh, particularly Bangladesh and India. Particularly in India, one is Bengal and Kerala. These are the two states where highest occurrence of this disease was there. So that means it started in Southeast Asia. From that Southeast Asia, slowly we could see them in India and Bangladesh. Nipah virus belongs to Paramyxoviridae family, as I already told, genus Nipah virus. It is RNA virus, primarily carried out by fruit bats, especially Pteropus genus, or else flying foxes are the bats what you see, fruit bats what you see in your surrounding area. You can see them in Western Ghats. Bats are considered the natural reservoir of this virus, and transmission often occur through the consumption of fruit contaminated by bat saliva, urine, or droppings. So the major reason why the humans are getting infected is mainly because of fruit or maybe the palm juice, which are contaminated by bat saliva, urine, or droppings. These are the three possibilities of transmissions. Human transmission. Human to human transmission of this Nipah virus occurs through a direct contact with infected individuals, especially via respiratory secretions or maybe body fluids. Close contact in healthcare settings within families can facilitate the spreads of this virus. Additionally, consuming fruits or raw date palm sap contaminated by bat excretion can lead to the infections. That means a fruit, if it is bitten by a bat, we should avoid it. If a fruit is directly carried with cats or anything else, is that we need to clean them. If we can avoid means we can avoid that kind of fruit, and fruit which are having a proper surface or maybe intact only we can eat, and we can reduce the chances of infections. So human, once it is infected human, then containing this is difficult because incubation period is there. If you look at this Nipah virus, you look at here. So initially what happened is there was a, I mean naturally fruit bat was the, this is from a Jenner Institute. So taken this this one to explain the things. So these fruit bats are natural survivor. They have an antibody to fight against this virus. It is an RNA virus. Now the thing is, what happens is, if a fruit eaten by bats, which are given to these pigs, pigs may get this virus. Pigs may ingested with this virus, and it will multiply in pig and start showing, and those who are working with pig can get infected. Now workers. Now the thing is, there is a lots of doubt whether the bat can directly transmit this virus, or humans are so susceptible to that or not. That's a question, because is it middle? There is animal which will amplify the virus and give to human beings. Even in Kerala case also, lots of theories are running that there was a goat which was infected from a bat, and that go from goat that boy got infected. All those things were there in the earlier case of Nipah outbreak in Kerala. But we don't know exactly the reason. But one thing is clear, the fruit bats are the natural reservoir. And if these bats eaten fruits are given to the animal, animals are not so immune to that. So they will multiply this virus inside their body and start showing symptoms. And those who are working with this animal, particularly in farms, larger farms, can get infected. And from them, this can transmit to another human beings. And if you look at the mortality rate is very, very high, like Ebola cases. Now, one more possibility is that, particularly in Kerala or maybe in case of Bengal and all, that palm saps, dead palm saps are people collect it and use it for consumption purpose. If these dead palm saps are not collected properly in a closed container, if they kept a open container for a collections, these bats are get attracted to the sweet saps. So they may put their droppings or urine to that when they drink this sap, or when saliva get contaminated with that. So that is sufficient to transmit the disease, because a large amount of virus may transmit through that. Load will be very high, so the human shows symptoms. And the particular person who is getting ingested with that, if they are immunologically compromised people, then there is no doubt, surely that whole humans will get infected easily. So that is the possibility. If you look at that older data, all remaining samples were test negative, and since 15 September, no new cases have been detected. This is the sixth outbreak of Nipah virus in India since 2001. And Nipah virus infection is a zoonotic illness, is spread to human through contact with infected animal, as I told, from bats or pigs or maybe any contaminated food eaten animals. Additionally, direct contact with an infected individual can also lead to transmission, although this route is less common. Those affected by Nipah virus infection may experience severe symptoms, including acute respiratory infections, fatal encephalitis. That's a challenging thing. The only way to reduce or prevent infection in people is by raising awareness about the risk factors and preventive measures to protect themselves. This is according to World Health Organizations. Case management should focus on providing patients with supportive care measures, intensive active, I mean the care, and severe respiratory and neurological complications is there, means we have to provide them a care. State and national authorities activated a multi-sectoral coordination and response mechanism to contain the spread of the outbreak, including enhanced surveillances and contact tracing, laboratory testing of suspected cases, high-risk contacts, hospital preparedness for case management, infection prevention and control, that's called IPC, risk communication, and community engagements. So this is a 360-degree angle of looking at a disease. Like around 10 outbreaks, as per sorry, around 6 outbreaks, around 6 outbreaks were reported in India, and many deaths were happened. Now the thing is, the recent outbreak is also, maybe the global warming, maybe the environmental changes, maybe the fruit eating bats are invading into human territory, or human invaded and settled in fruit bats territory. Because of this human animal mammal conflict, this is a quite common problem, and the major problem we are facing is these viral transmissions, which is really a dangerous, because this virus of zoonotic origin, we don't know whom got infected, and once they start showing symptoms, which by the time that disease might have transmitted to from index patient to the primary contacts. Then these primary contacts might have traveled a longer distance and might have contact given disease to secondary contact. So the tracing them, quarantining them, testing them, isolating them, treating them, giving them support are all difficult. So at the initial stage, if you can manage with awareness and preventive measures, it's easy to contain the disease. Now, what are the symptoms? So when you look at symptoms and pathogenesis, when a person got infected with this, the incubation period for Nipah ranges from around 4 to 14, around 2 weeks. May go up to, if you are immunologically strong and viral load to reach the level to show the symptoms around 14 days. What are the clinical presentations? Nipah virus infection can manifest in various ways, ranging from asymptomatic or mild flu-like symptoms to severe conditions like encephalitis, that means inflammation of the brain or respiratory illness. Common symptom includes headache, dizziness, cough, respiratory issues, confusions. In severe cases, it can progress to coma or death. So the mortality rate is really, really high because the people don't take initially, I mean, people don't test in the initial. So if the suspected case is tested and supportive care is given at the beginning, then chances of survival is high. But this won't happen in all the cases. Pathophysiology. The virus primarily targets the central nervous system, leading to severe brain inflammation. This is the challenging one because this virus is primarily targeting the central nervous system. The infection severity and outcome can vary widely among individuals with certain factors like age, overall health influence the prognosis. That means whether a person is getting infected or not, that depends on how good his immunity is and how healthy he is. If he is comorbid, if he is aged, if he is very young, so he or she is very young, I mean the infants or maybe young children, then chances of mortality is very high because their immune system is not so strong at the younger age as well as in the adult. But there are people who survived from this even after monoclonal antibody treatment and all. Many people have survived. So now diagnosis, how we will diagnose this? As usual, in all viral diseases, we diagnosing Nipah virus infection involves various laboratory tests, including polymerase chain reactions. As we all know, the polymerase chain reaction is a common way to detect virus. What do we do here? What do we just take the fluid from human beings, then we transfer this fluid to sample to VTM, viral transport medium. So why do we transfer this into virus? Because the virus should not die, so it should maintain in that physiological condition. So transfer to viral transport. Then we just extract the DNA, RNA from RNA or DNA, anything, any virus. I'm saying, in case of your RNA, then what we do is we go for a PCR. Particularly in RNA we go for RT-PCR. So in RT-PCR, the PCR, as you all know, Gary Mullis is the one person who invented that technique and which helped us a lot to clinically identify that. So what happens, it amplifies, and by using that we can detect the presence of particle. So we will get a load also. C value also will get, sorry, CT value also will get, which you can tell us what is the load of that virus. Currently, no specific antiviral drugs are available for treating NIV infections. Supportive care remains the primary treatment approach, focusing on managing symptoms and providing intensive supportive therapy, such as mechanical ventilation in severe cases. That is the only possibilities. Now, when we look at this diagnosis, Nipah virus infection can be diagnosed during illness or after recovery. That is the one thing as for CDC. And different tests are available to diagnose NIV infections. During early stages of the illness, laboratory testing can be conducted using real-time PCR, as I told, from a throat or nasal swabs, or maybe cerebrospinal fluids, urines, and blood. Later in the course of illness, after recovery, testing for antibody is conducted using an enzyme-linked immunosorbent test. Once the person is recovered, if you wanted to test whether the person got infected with Nipah virus or not, we can use it ELISA test also. Early diagnosis of NIV infection can be challenging due to the non-specific early symptoms of the illness, because these flu-like symptoms are quite common for most of the infections. So then it is very difficult to differentiate whether it is NIV infections or whether it is common flu or corona. It's very complicated. However, early detection and diagnosis are critical to increase chance of survival among infected individuals, as I already mentioned. To prevent transmission to other people, to manage outbreak response efforts, and NIV should be considered for a people with symptoms consistent with NIV infection who have been areas where Nipah is more common, such as Bangladesh or India, particularly if they have known exposures. So that is the thing. So, because as we all know where we are living, if we are living in a prone area where chance these kind of incidents are high, then that's a possibility. As you all know, currently there are no licensed treatment available, and the treatment is limited to supportive care and rest, hydration, symptoms. As per the symptoms, we'll give them treatments. There are, however, immunotherapeutic treatments, that is, a monoclonal antibody therapies are one more possibility. The, that means currently under development and evaluation for a treatment of NIV. One such monoclonal antibody has completed phase 1 clinical trial and has been used on compassionate use basis. In addition, the antiviral treatment remdesivir has been effective in non-human primates when given a post-exposure prophylaxis and may be complementary to immunotherapeutic treatments. The drug ribavirin was used to treat a small number of patients in the initial Malaysian NIV outbreak, but its efficacy in people is unclear. That means most of the treatment methods what they followed, either by using antiviral drugs or maybe monoclonal antibodies. There is a cases of monoclonal antibody recover, no doubt about this, because this monoclonal antibody, if we need for the treatment, then we have to get it from Australia. There is one Australian company which produces these monoclonal antibodies. Now, the prevention and control is the easiest way. As we all know, prevention and control is a main way. So, public health measures. Preventing NIV outbreaks involves several strategies, including public awareness, campaign to educate, communicate about the risk of associated with contact with the infected animals or consumption of contaminated foods. So, practice hand wash. I mean, particular areas where Nipah virus outbreaks like Bangladesh, Malaysia, India, Singapore, people should practice hand washing regularly with soap and water. Avoid contact with sick bats or pigs. Avoid areas where bats are known to roost. Avoid eating or drinking product that could be contaminated by bats, such as raw dead palm shoots or raw fruit or fruit that is found on the grounds. Avoid contact with the blood or body fluids of any person known to be infected with NIV. Because NIV can spread from person to person, standard infection control practice and proper barrier nursing technique are important in preventing hospital-acquired infections. The first outbreak in Kerala, there's a nurse who passed away due to this infection. That's the challenging. Nosocomial transmission is a setting up where a patient has confirmed or supposed NIV infections. So those who are treating them can get the infections and they may be the victim of it. Other geographical locations may be at risk for NIV outbreaks in the future, such as regions where flying foxes live, that is, our bats will name. These bats are currently found in Cambodia, Indonesia, Madagascar, Philippines, Thailand. People living in or visiting these areas should consider taking the same precautions as those living in areas where outbreaks have already occurred. In addition, there should be steps individuals can take to lower their risk for NIV infections. It will be critical for scientists, researchers, communities at risk to continue learning about NIV to prevent future outbreaks. A broader prevention efforts include increased surveillance of animal people in area where NIV is known to exist, increase research on the ecology of fruit bats to understand where they live, how they spread the virus to other animals and people, evaluation of novel technologies or method to minimize spread of the virus with bat populations, improving tools to detect the virus early in communities and livestock, reinforcing protocols for healthcare settings on standard infection control practice or to prevent a person-to-person spread, raising awareness about signs, symptoms, and risk of NIV among populations at higher risk due to geographical locations, contact with fruit bats or items contaminated by fruit bats, or contact with pigs or animals that could come into contact with fruit bats. Work in healthcare settings or maybe in caregivers for people infected with NIV. So when we talk about these control measures, healthcare workers are the one who are prone for it, because unless they wear PPE and as per the World Health Organization's protocol, if they don't work, surely they will get infected with this virus. Reducing the risk to, this is the one more challenge, reducing the risk to bat to human transmission. So what we have to do is, this is according to World Health Organization, the freshly collected date palm juice should be boiled and fruit should be thoroughly washed and peeled before consumption. Fruit with sign of bat bite should be discarded. Areas where bats are known to roost should be avoided. So this is the one thing. If it is fruit is contaminated, throw that, don't eat that. The risk of international transmission via fruit or fruit products such as raw date palm juice contaminated with urine or saliva from infected fruit that can be prevented by washing them thoroughly and peeling them before consumption. So any fruit, if we peel and eat, then chances of contamination is very low. Reducing the risk of animals to human transmission. So it's a bat to human transmission is one mode, but there is a possibility of animals to human transmission. Natural infection in domestic animals has been described in farming pigs, horses, domestic and feral cats. The gloves and other protective clothing should be worn while handling sick animals or their tissues and during slaughtering or culling procedures. As much as possible, people should avoid being in contact with infected pigs, particularly large like China, Cambodia, Malaysia, and all. They have a large farms where they rear pigs. In endemic areas, when establishing a new pig farms, consideration should be given to the presence of fruit bats in the area, and in general, pig feed and pig sheds should be protected against the bat when feasible. So we should avoid biting of bats, unlike some of these vampire bats. They will attack the pigs and they bite the pigs. That may be the one possible way. Another is fruit, which is fruit waste, which we collect from a forest or maybe from a field, which might be contaminated with this one. So that we give as a food to pig. Pig will get infected. Samples taken from animals with suspected Nipah virus infection should be handled by trained staff working in suitable equipped laboratory. Simply, we can't. It is not a normal infection. It is a life-threatening infection. So we should handle the sample with full care. Utmost care we need to handle the sample. Otherwise, the person who is handling, a person who is working with, may also lose the life. So vaccine and research, where we are today when we talk about this disease, where exactly the stand. The efforts to develop vaccine and therapeutic intervention against Nipah virus infections are ongoing. Across the globe, people are working. Several experimental vaccines have been shown promise in animal models, but their efficacy, safety in humans require further evaluation and thorough clinical trials. Many vaccines are developed, but those vaccines are successful in animal models, but still their efficacy and their safety should be tested in humans, particularly in clinical trials. Once the clinical trial is finalized, we'll come to know whether the vaccine is working or not. So this is the one deadly disease. So taking vaccine is I mean, developing vaccine is a risk. But at the same time, if unless we develop a vaccine, there is a possibility in the future also that these mammals can bring the disease to humans, no doubt, because we are all living in an area where fruit bats are dominated. One of the most seen dominated flying mammal. Now, Nipah virus outbreaks can have a significant socio-economic impact. That is the one thing, including, see, particularly if, things which are rambutan. Initially, there was a notion that rambutan is the one fruit which causes this disease because bat might have eaten this rambutan and all those things. But that's why the rambutan market is dropped. People don't want rambutan at all. So that's why it will have a socio-economic impact, including disruption of healthcare systems, loss of livelihood in affected areas, fear leading to societal. That's a stigma associated with. This is the challenging one. Particularly the people, if they don't understand, then the stigma will stay for a longer time. Then government should put kind of a concern. It's a concern for a public sector also. Given its potential for a person-to-person transmission and the lack of specific treatments, NIV remains a concern for global health authorities. Because why we are worried about this NIV? Because there is no proper treatment, there is no proper vaccines, and exactly cause, route, we are not clear whether it's and it was found out that the whole story started from bat. Still, it's not exactly clear whether the how the things are transmitted. Some people say it's contaminated food, but there are cases where people have not touched food at all. They have not eaten food, but in such a cases also NIV was detected. So it's a real concern. That is a challenge. Nipah virus disease present a complex challenge due to its zoonotic nature. Because we are living, particularly in tropical countries, what really happens is human mammal, human animal conflicts are quite common, right? The potential for there is a chance, high chance of human animal conflict, and because of that, what really happens? Anything which is there in animal can transmit to humans. So potential for human to human transmission high, severe clinical manifestation. So this is the thing. Animal to human, human to human. See the two things: bats to human, bats to animal, animals to human. So these are the three possible ways. Addressing this threat require a collaborative efforts across disciplines, including virology, epidemiology, public health, healthcare delivery systems to prevent, detect, respond effectively to outbreaks and minimize their impact on both human health and societal well-being. So that means at the end of the day, to manage all these diseases, particularly disease which are not having uh, proper treatment or maybe proper uh, adequate knowledge now. So now you look at one more thing I just wanted to before closing. These bats we can see in Australia, Bangladesh, Bhutan, Brunei, Burma, Cambodia, China, Guam, India, Indonesia, Laos, Mariana Islands, Malaysia, Nepal, Pakistan, Palau, Papua New Guinea, Philippines, Singapore, Sri Lanka, Taiwan, Thailand, Timor, Vietnam, all these Southeast Asian countries. And when we see this, but cases were not reported. Cases were not reported from all the places. That means not all the time spillover happens. Spillover happens at specific time at specific places. And if it is happens at specific places and we could control them, means there is a possibility that this won't go beyond the level of our understanding. But there is always a high risk involved because these humans are in close contact with these animals, I mean these mammals in all the time. And we don't know whether we can follow all protocols at all the time everywhere. So that's why the proper high standards put forward by the World Health Organization, we can if we follow, then chances of mammals to human transmission can be reduced. That is very important. After transmission, it's very difficult to treat, but once it is transmitted, if we can manage it early stage, then we can contain it. But if it's spread to central nervous system, then treatment is absolutely difficult, no doubt about this, because most of the earlier cases were given as a clear idea that it's not so easy to treat. Particularly in Kerala cases, three patients were died, and they were diagnosed at the beginning. They were given all supportive cares, but no, they couldn't because they were all aged. But one boy, 13 years old boy, also passed away due to this infection. But there also they couldn't, because a Nipah viral infection was detected at the late stage. So as early we detect it, we can prevent it. The only easy way is don't eat anything which is contaminated with bat or maybe fruit bat contaminated fruits.